Okay, we're gonna start.
Okay.
Great. One second, Ellie, don't see you or hear you yet.
I'm here. I'm here. You hear me?
Amazing.
Amazing. Hey, what's up, guys? How are you? Looking forward.
We don't see you.
You won't see me yet. You'll see me in about 5 minutes.
Okay.
Okay, bye. I'm on mute for now. I'll check in if I hear my name. Here. 1 minute. I just don't want to have noise back when I'm going here. Yeah.
Okay. Okay, we're gonna start in a few minutes. Just waiting for everyone to come into the room. Okay, great. I'm going to start now. Hello, everyone. I'm Rachel Banyan, family nurse practitioner and CEO of IV Trips. And we have a few panelists here with us today. I'm going to introduce everyone and talk a little bit about what we are going to spending the next hour talking about. So I want to first introduce Dr. Deitch. Dr. Deitch is a cardiologist in New York City, has been practicing for over 25 years. And he's going to be talking about his experience today with GLP-1s. I am really happy and honored to have him on our panel today. Our next panelist is Hannah Chandler. We recently actually connected through her social media platform. She has been speaking up about GLP-1. She's a registered nurse as well as someone who has lost over 100 pounds on this medication. And she is going to be speaking about her journey. I always say I am very honored and grateful for people who speak up about their journey on GLP-1s and make themselves vulnerable about talking about it, because I know it's not easy, but when we are able to do that, then it really helps other people. Ellie is going to be joining with us in 1 minute. I'm going to introduce him, though. He is actually a patient of mine who's lost over 25 pounds. He's in the middle of his GLP-1 journey with us, and he has made incredible strides throughout his journey. And I'm really honored to have him on board to be sharing his journey. As you know, I personally use this medication as well. I struggled to lose about 20 pounds and I couldn't lose it despite diet and exercise. I went on this medication and really learned how revolutionary they were. They not only help with weight loss, but they help with so many other things outside of weight loss. It really helps people rechange and rewire their brain and how they have certain habits and how they eat certain foods. And it also helps decrease inflammation. And I believe it is a drug that is revolutionary and going to help people live longer. The key point is that we use it correctly and use it with guidance so that we're able to really, really understand how to go on these medications and use it accordingly. So I'm going to start with Hannah. I'm going to turn the mic to you and ask you a question a little bit. You can share with everyone just about your journey in terms of your health and your weight loss journey. You know, what did you do before you decided to go on a GLP-1, and how many pounds did you lose? And just what made you decide to go on it? Because, you know, there's many people that are hesitant about it. If you lost over 100 pounds, you've been on it then for probably over a year. And so a year ago was also even more taboo. And so to go on it over a year ago, I think that's still, you know, you're one of the leaders in the space. So can you tell us a little bit about your journey and, yeah, what was the deciding factors?
Yeah, so I'll get to the story of how I actually ended up signing up to go on the med. I think it's kind of funny. But kind of like my health history, I actually grew up in like as a healthy weight for most of my life. There were periods of time where I was having kids that I gained more weight and I lost 50 pounds about twice without a GLP-1 medication before they were even around. So I'd done it before, but the whole time, I mean, I was always fighting against that food noise, always. So it was always just like a struggle every time. I felt like I was just depriving myself and fighting and thinking about, the cookie and the pasta all the time. And so it was just stressful. And then I ended up having 3 daughters in about 2.5 years. And I just couldn't put up the fight anymore. I just couldn't do it. Life was too stressful. So I just kind of gained and gained until I got to the point where I was, 240 pounds. I was out on a 5'5" frame. And I was just miserable. And I was constantly thinking about what meal plan am I going to do? Okay, I'm going to start on Monday. I'm going to do this. And I would start and then I just couldn't keep it up. Or, there was a period of time where I felt I'm doing all the right things and it's not moving. And it just was so infuriating. So I kind of heard about GLP-1, and like you said, at the time, it was even more taboo than it is now. It was not really like, okay, people are going on this and it's working. It was just all the celebrities are on Ozempic. So I actually was hosting a fundraiser at my house and somebody asked if I was pregnant. I was like 3 years postpartum at that time, not pregnant. And so I drank a little bit more than I should have that night. And I was sitting on the couch after everyone left, and a commercial came on for a telehealth company for GLP-1. And I think it was the mixture of too many mimosas and just being at this breaking point of like, I cannot live like this anymore, that I just took the risk and I signed up and I did it. And thank goodness, because it's been the best decision I've ever made for my life. So, yeah.
And how many pounds did you lose in how long?
Oh, I've lost 115 pounds and I've been on for
Wow.
about 14 months now. Yeah.
Wow.
Yeah.
Wow.
Congratulations.
Amazing.
Thank you.
And but so what, by the way, just when you went on it, did you share that with your like friends and family, or did you not did you tell people that you were on it, or was that like something that you didn't share with people?
Yeah, so I didn't tell anybody. Like, no, well, I told one person and it was my mom. And it was actually because my mom had struggled with her weight for my entire life too. And so I called her up. This was about 12 hours after I took my first shot because I noticed that food noise reduction right away. And I called my mom and I said, "This is really inappropriate. And I can't believe I'm about to say this to you, but I really think you should consider this medication because I can already tell this is going to change my life. I didn't even realize what I was dealing with." I said, "We haven't really talked about this, so I don't know if you're dealing with this too, but if you are, I would really consider it." And she's like, "Okay, I'm going to watch you." She watched me, and a few months later, she went on it and she's down like 75 pounds too. So
Wow.
yeah, but I
Wow.
didn't tell anybody because I was just it was so ashamed. And again, back then, no one, I mean, the judgment even still, but back then it was even worse. I'm like, I'm not telling anybody. So
Wow. Thank you. So, Dr. Deitch, can you tell us a little bit about why GLP-1s like Ozempic, semaglutide, Mounjaro, how they help decrease cardiovascular risk, and how, what's the connection between cardiovascular risk and GLP-1s? Can you give us a little
Sure,
bit of an understanding?
sure thing. So basically, the approach to this and understanding of it stems from basically for one thing. There are two aspects of it. One is sugar control in a diabetic. So when sugar in a diabetic is not well controlled and the sugar goes up, it leads to weight gain. And those two things together can increase risk of high blood pressure. It also can increase one's cholesterol. Plus, when the sugar is elevated, that directly leads to plaque formation in arteries in the body, as well as high blood pressure doing it and cholesterol. So having an elevated sugar, having an elevated weight, having high blood pressure, high cholesterol, they're all linked together and they're sort of interdependent of each other. So by decreasing sugar and decreasing weight just alone, there's generally a tendency to get a lower blood pressure, a lower cholesterol, and better control of sugar, all of which decrease the chances of arteries becoming filled with plaque. So in that regard, it lowers cardiovascular risk. There's also some evidence that by lowering one's weight, you also decrease the chances of even sleep apnea, which in and of itself is an independent risk factor for heart disease because of the transient drops in oxygenation during sleep, which causes injury to blood vessels and can cause plaque formation as well. So there's the sugar control, and there's also just the direct effects on lowering weight.
Okay, thank you. And what
Sure.
is your overall opinion about these medications?
Well, every now and then in medicine, there is sort of a eureka moment where we address certain really serious health problems. And, most of the time, the benefits that occur over time and the changes in therapy are incremental and relatively small. But then this is sort of one of these eureka moments where there's a literally, world-changing medication that is incredibly effective, extremely well tolerated, and also for one of the first times correlates with actually lowering cardiovascular risk, because many medications that exist and have existed for years that affect appetite and promote weight loss have a lot of cardiovascular side effects and are sort of neutral at best. Sometimes they're even harmful. Sometimes they're neutral in terms of cardiovascular risk. This medication has been shown to conclusively, this class of medications have been shown to conclusively lower cardiovascular risk, meaning less chance of heart attack and less chance of stroke. So in that regard also, they're really a very unique class of medications and sort of a revolution in care for weight control with diabetes.
Yeah, thank you. Thank you.
Sure.
I do believe they are revolutionary. I mean, and it's funny because the ironic part is that these other drugs that have been helping with weight loss were actually really bad for you cardiovascularly, like
Absolutely. A lot of them are stimulants that
Yeah.
have an effect on the adrenaline system and can cause tachycardia or a rapid heart rate, an increase in blood pressure, and theoretically could even increase risk of heart attack. So these, on the other hand, are not only neutral, meaning they're not just have no effect, they actually are beneficial. And there's data that you have less heart disease risk when one is on these medications, which is really, that also is part of the revolutionary aspect of them and how they're so unique and have really literally changed our entire approach to not only diabetes, but weight control with it as well.
Yeah, correct. Thank you. So, Hannah, back to you. Aside from losing weight, what has been the biggest change in your life going on these medications? And it could be like even, socially, emotionally, physically, like what are the other things that you notice that when you went on these GLP-1s, that your life's changed?
I would say the biggest is just the change in my mental health, which has then changed so many aspects of my life. I mean, just something else, for myself personally, I always struggled with just tons of anxiety, and my anxiety is at it's a regular level of anxiety now. It doesn't take over my entire life, but I think that has to do with everything that I've been able to do while on the med. Changing my eating habits, changing my movement habits. But just the shift in my mental health has changed my relationship with my husband. It's changed my relationship with my kids. I am going out with friends more because I was able to lose the weight, and I am not going, I don't have anything to wear. I don't want to go out. I'm embarrassed to be out with people. So I'm out more. I'm out with my husband more. I'm able to physically interact with my kids in a way that I wasn't able to. So and then that, increases my mental health overall too, because I'm doing all of these things I wasn't able to do for so long. And so I feel like I'm going to say this multiple times during this, is that I don't have one answer, because so many aspects of my life have been, every aspect of my life has been changed for the better since I went on a GLP-1. So
I can also corroborate that if I can, that, I have patients coming in every few months, and as they come in and their weight is down, another 5, 7, 10 pounds, they're happier. They have more of a sense of well-being. They have more energy. A lot of patients I've seen, initially came to me very, very overweight with arthritis. Their arthritis isn't cured, but their pain level is much better. So their mobility is more, they can engage in sports, they can travel, they can walk around the city, they can do more things in their life. Their interpersonal skills are better. Many of them make the same joke that the worst side effect they have is that they have to buy a new wardrobe. That's a lot of times the main side effect that they complain about is none of my clothes fit me anymore. and they need new clothes. So that makes me happy when that's the worst side effect that someone has in any medication. So
Yeah, that's great. That's great. You know, one of the things that I changed in my life when I went on a GLP-1 is I cut alcohol, which was really a great decision and it helped me sleep better. And with that helped me sleep better, I had less of a, like the ghrelin hormone that, pulled me to carbs was less. And so like what you were saying, Hannah, it's almost like a cycle, right? So it's like, I don't feel good about my body, then I don't go out. So if you don't have the social connections like loneliness and depression, and then that leads to more eating.
Yep.
And so it's like a cycle that's like combining, like, and then you're also not as physically active because you don't feel good about yourself because you're home. And then so it's just like this cycle that it really breaks the cycle for people, that it's so hard to do. When you start feeling good about your body, then you start moving more, you start interacting more, you start smiling with people more, then the connection, so then the more dopamine. And so it's like you said, it's not one answer. It changes people's life of all the different factors that it does. So, okay, Ellie, I'm going to pose a question to you. Are you with us?
I'm here. Yes, absolutely. Sorry, I had to be in the car, so I don't have a video on, but I'm here. Absolutely.
Okay. So can you tell us a little bit about your weight loss journey? And, when you came to me, I know that you were, just struggling. If you believe that you went on it, you didn't have a good journey on it.
Right.
You lost weight, you gained the weight back, and then you decided to go on it with us. Can you tell us a little bit about your weight loss journey and how many pounds you lost?
Absolutely. So I actually tried Ozempic, and I did it on my own, sort of, about 3 years ago. I wanted to knock off about 30, 40 pounds. It was before the summer. So I got this, I was introduced to a doctor. It was like when it started coming out. I think it was even before Manjaro. I think Ozempic may have been the only option at the time. So I went to the doctor. I got this prescription. I got it from Canada, yada, yada. And I went for the kill right away. I felt awful, fatigue, weak. I was just like, it worked, but I didn't enjoy it. I was miserable with it. And I just, I lost the drive to continue with it. And I'd lost about 20 pounds at the time. But you know, uh, 18 months later, it's all back, plus interest. Which is when I was introduced to Bracha with IV drips, and I, shared my experience with you, and you were like, "There's a way to do it, and there's a right way to do it. You don't have to go for the kill; it has to be adjusted. You want, we did the tirzepatide, right? And I was guided through every step of the way with how much to take, and we started with this amount and on this day. And I have to say that I wasn't nauseous. Not only that I didn't have the fatigue side effects, but at the same time, like Hannah was mentioning, and like we just discussed, um, it gave me such clarity, even at work, in the business. I woke up. I felt like I slept. I felt like I slept. I felt like a human again. So it also keeps you dry, and also I put myself onto a healthy habit way of eating. So it starts off by force. You want to eat that pastrami sandwich, you just can't. And then at a certain point, when you're eating soup and vegetables and protein, and as you guided me through it, and it's like, even if I would stop the medication, right, I would still continue on it just to roll it a little bit longer. But I'm so happy with how I feel just from the foods that I'm eating. I just feel so much healthier, so much easier, so much. And yeah, about the changing the wardrobe, we're down 2 sizes already.
congratulations.
I'm 6, 7, about we're 7, 8 weeks into the journey, and we went down close to 3 sizes on my
Great.
suits. So it's pretty epic, I gotta say. And it's also it's a habit. This is what Bracha said in the beginning. We would start slow, and you would sort of, like a therapy. It's more of a therapy of how to train yourself to actually eat. And my goal is to continue with it and continue eating the way I'm eating without being on the medicine. But it's a phenomenal experience, I gotta say, all around.
And I'm going to
100%.
ask you one more thing because we did the glucose monitor for you. So
That's correct.
sometimes with
Yes,
certain patients, we put them on the glucose monitor before we put them on GLP-1s.
that's right.
Can you tell me a little bit what you learned with that experience by seeing your sugar live time about how you were eating? What was your main takeaway?
So exactly. I forgot to skip that. I'm so excited with the weight loss that we forgot where it all started. So the first step before we even went on the medicine, uh I went on this glucose monitor, and I monitored every spike. I would get an alert on my phone every time there was a spike. I'm 30 years old, and my sugar should be at the 80s, right? 80s, 90s or so, and we were spiking pretty high, and it was alarming. So I also saw what the spikes were, if it was the weekends, if it was carbs, if it was alcohol, etc., etc. And based on that, we also knew when to do the shot. And Bracha was very good with creating the treatment plan based around when we saw those spikes and when we saw. And I tested the sugar after that, and my sugar numbers dropped by like 50 points. It was it's sort of magic.
Yeah,
That's great.
great.
Congratulations. That's excellent.
Yeah, that's good. Thank you, Ellie. Hannah, back to you. And let me just add one more thing. One of the things that we do is helping patients with sugar spikes, which is so cool. And I believe everyone should do it once in their life, where they actually, so different than, just get a blood work. It's actually seeing day in and day out for over 10 days.
Absolutely.
We're able to see what spikes your sugar, what brings it up. Sometimes people also aren't aware about how many times a day their sugar spikes. One of the patients that we had that we put them on this, she said, I was, even this before she went on the GLP-1, she said, just from understanding that my sugar was still high from the meal I just had, and I saw myself going back to the fridge, and I thought, I see that my sugar's still high, like my body's still trying to bring down the glucose, and
Absolutely.
you were just talking about how glucose elevation is really the risk of cardiovascular disease. So just even having that awareness is step one in people's weight loss journey, because we're not so much aware about how many times our sugar and our insulin spikes on a given day. And just seeing it on a blood work is not necessarily going to tell us so much. And so it's a really, really cool experience to go through. Hannah, can you tell me a little bit about certain habits that you either gained or eliminated through your weight loss journey? Because this has definitely changed a lot of your habits, and that's like a big part of this journey, right? It's not just about decreasing appetite. Tell us about different habits that, because you went on a GLP-1, you were able to either eliminate or, start.
Yeah, I mean, my day-to-day looks so different now than it did before I started a GLP-1. Even when I was a healthy weight and not on a GLP-1, I mean, my habits are so different now. Obviously my eating habits are way, way different. I mean, I'm not spiking my blood sugar 1,000 times a day because I'm not snacking 24/7. I'm eating a meal. I'm feeling satisfied from that meal. My body is processing it. And then I'm eating again when it's time to eat again. And I'm eating a really balanced, well put together diet, rather than just grabbing what I can. When I'm hungry, I go for, how am I feeling? Do I need some protein? How much fiber have I had today? I'm able to actually think about those things now that I'm on the GLP-1. But like my movement habits too, like when I'm choosing what am I going to do today, I'm choosing things like, it's nice out, I'm going to go for a hike. I'm going to take my kids out for a walk. We're going to go do these other things. And then I think you mentioned alcohol. I mean, I haven't had alcohol in over a year now at this point, which has also just been life-changing for me. I mean, that nightly glass of wine habit, that's gone. Like that's gone. And I think I never would have been able to get out of that habit without a GLP-1 too. So yeah, I mean, just everything, everything again.
Yeah.
Like my habits are just so different.
Yeah, if
Yeah.
I can add on to what Hannah said about waking up in the morning and taking a hike, I mean I'm not that athletic. I do bike in the summers and everything, but I never ran. I was always like too lazy, didn't feel like it. And now that I knocked off about close to 30 pounds, next thing I know, I'm buying sneakers. I got these custom running shoes and the running bike gear. I'm starting to run the park and Prospect Park. It's like it just changes. It's a chain reaction with it's great. It's like I can't wait for the next run. It's the adrenaline. It's phenomenal.
And I
Yeah.
don't
I
know
just,
if you were
if
like
I could, oh,
this
sorry.
before, like, oh no, go ahead.
Well, I wanted to just add about, the glucose monitoring, like high blood pressure is what we call in medicine one of these so-called silent killers, because you can have high blood pressure that's pretty significantly elevated and have it for years and have absolutely no symptoms whatsoever until one day there's a heart attack or there's a stroke, okay, or one develops congestive heart failure symptoms, and then it's really, oftentimes irreversible. Having your sugar monitored continuously, we have no idea what our sugars are during the day. There's just no way to know. Your sugar could be 80, it could be 120, you'll feel the same way, right? But by getting continuous glucose monitoring and seeing a curve, and seeing objectively exactly what is the plot of your glucose during the course of a day, and you see those spikes and you see those spikes go down on therapy, you'll see, really direct evidence of, what was and what is once you start therapy, and it gives you firsthand evidence. I also want to add one more thing about the medication, about what you're saying about the dietary habits. One of the beautiful things about these drugs is that they decrease gastric emptying. So when you eat, your stomach doesn't empty the food immediately into your small intestine. It sort of slows down a little. And one of the ways that appetite is suppressed is because your stomach fills up more quickly. So, the feedback of, like, if you ask yourself, well, how do I know when I'm full? What does being full mean? How do you know when it's time to stop eating? And one of the ways is that when your stomach distends, there's a neurochemical feedback to the brain that your brain tells you you're full, stop eating. So by having the stomach fill more and empty less, you achieve satiety that much quicker. So that, and in addition to that, the drugs directly stimulate appetite suppression in the brain. So you don't want to eat more. Your appetite goes away, or most of your appetite goes away. So it really makes weight loss even that much easier. So, metabolically, your sugar's being managed better with the medication, but also directly, your brain is being told, eat less, and you don't miss the food. So that's another wonderful thing about it.
Amazing. Thank you.
Sure.
Hannah, did you want to add something?
Oh, trying to remember what oh, I was gonna ask Ellie, I don't know if it's been like this for you, but for me, every time when it was the perpetual, like I call myself an ex-perpetual Mondayer. It was always Monday, I'm gonna start, Monday, I'm gonna start, Monday, I'm gonna start. But it was
Totally.
always, I'm gonna change my whole life. It was, I'm gonna wake up and I'm gonna have this morning routine, and then I'm gonna do this, and I'm gonna go to the gym, and I'm gonna eat like this, I'm gonna meal prep, and it was everything all at once. But going on this medicine has helped me to build these habits really slowly, like how you're saying, now that I'm down, 30 pounds, now, okay, I'm thinking about moving my body a little bit more, and we're gonna start slow, and then we're gonna build up. And so I think for me, at least, over like building those habits that I've built over the last year, rather than, okay, it's Monday, it's time to change my life. It's been like, no, I'm on the medicine. I trust that I'm going to continue losing weight. I trust that. And so I can build these habits slowly and not be so anxious to like do everything all at
100%.
once.
I'll tell you a little secret. I have this Peloton since COVID sitting in my house. And somehow, I don't know what it is, but about 3 weeks ago, it was the first time, maybe since COVID, that I used it. It's like I told my wife I need a new pants rack because it's actually going to be in use right now. And Bracha, thanks to you for that.
Thanks
And
for trusting her.
and the way in which these medications are being used is evolving. Like I was saying, it's not only a revolution, but it's also an evolution over time. Like, a lot of times people want to achieve a certain weight goal, right? So for most of these types of medications in the past, once you achieve that weight goal, you would say, okay, time to stop the medication. And then a lot of times when you do that, the weight might rebound, right? But with these medications, again, it's evolving. The entire approach to how to dose it is changing. So you can decrease the frequency of the medications. You can use very, very small dosages once a week or every other week, something sort of just once you achieve your goal, just to take the edge off so you achieve a steady state with your weight. So again, the management of the weight once you achieve goal can be continued use of the medications with altered dosing or altered frequency or both. That way you always have that sort of appetite suppression in your corner. So you don't have to fear that you're just going to like fail. And then in 6 months, you'll be back where you started from. You'll have the appetite suppression, not as strong because you're not working on big time weight loss anymore, but you're working on sort of maintenance.
Maintenance. Yeah.
Right. And then the dose can be lower, the frequency can be lower. So this entire approach to this is, it's so flexible that it really, lends itself to helping patients long-term, indefinitely with usage. So that's another reason why I'm a big fan of it.
Yeah. And Dr. Deitch, can you tell us how you're using GLP-1s in your practice as a cardiologist?
So I'm using it in a variety of patients, some with heart disease and diabetes, because basically it's a great drug to give diabetics or pre-diabetics with known heart disease, blocked arteries, plaque, etc., to lower their overall cardiovascular risk. So I'm using it to treat diabetics with heart disease. I'm also using it to treat people who may be at high risk of heart disease, who don't have heart disease yet. So for primary prevention, just somebody who has to either lose some weight or get their sugar under better control or both. And they're going on these medications to lower cardiovascular risk because there's data now that will do that. So I'm also using it on people who are non-diabetic, who also just want to lose weight because there's so much evidence of cardiovascular benefit, plus the other non-cardiac benefits of potentially decreasing the chances of arthritis, sleep apnea, high cholesterol, high blood pressure, all the things that come from untreated, severe or moderate weight gain that will come in time. So I'm using it in a variety of patients. I always say that in my practice, I not only treat heart disease, I try to prevent heart disease. So I'm definitely trying to prevent heart disease in a lot of patients. And this is one of the ways I'm using, one of the ways in which I'm using it.
And what would you say about people who are, there's still people that are, I'm nervous about the medication, I'm nervous about side effects. What is your response to individuals who are nervous about side effects on these medications, whether the side effects could be nausea or, some people are concerned. They're like, well, I'm not diabetic. Will I become diabetic? Well, I don't have cardiovascular risk. Like, will I get cardiovascular? There's no long-term studies on this, even though the medication, there is, but the people have concern around these medications. So what's your response?
So my response is that in all medications that we give, we always have to factor and evaluate the risk and the benefit. So the main side effects you see with these medications, things like nausea, diarrhea, sometimes constipation, sometimes vomiting, sometimes a little GI upset, right? So the vast majority of the time, those are not severe side effects. So the first thing you ask the patient is, do you have any nausea, vomiting, or diarrhea even before I start the medication? Because you don't want someone who is nauseous often to say, well, I'm still nauseous, so I'm going to stop the drug. So you have to weigh out, what are these really serious side effects, and would they really impact one's, ability to take the drug? And the other thing I tell them is, expect there might be some side effects early on as your body gets used to it, but you can try to counter it by maybe having a little food during the day, like a little cracker or bread when you take the medication the first hour or two. Make sure you hydrate with a lot of water to avoid dehydration. That's a very, very important thing, to avoid dehydration tremendously. And also just emphasize to them that the overwhelming vast majority of patients have absolutely no major serious side effects with these medications, the overwhelming vast majority. So, when you weigh out the risk, the real serious risk of these medications, which is minuscule compared to the potential benefit, which is huge, the vast majority of people should really not worry. There is a small group of people who have a very rare genetic endocrinological tumor risk. Most people know they have it. If not, they can always check with their doctor, but that's, again, a very tiny percentage of the population. The reality is that the overwhelming vast majority of people can take these medications and not worry about major symptoms and major side effects at all. Plus, if they have side effects, we can work around them. We can tell people, have more fluids, drink a lot more water. Maybe I'll give them a little ondansetron under the tongue, or Zofran, which is the brand name, under the tongue for the first couple of weeks, once in a while, as you get used to it. And mind what you're eating. Maybe you're taking the medication and you haven't slowed down your eating a little bit. Maybe you have to have smaller meals, maybe 3 or 4 times a day as you get used to it. So the main thing is, don't jump ship and abandon a medication the first time there's something that you think could be a side effect, work with your doctor, because the reality is that virtually anybody can take these medications safely and effectively.
Yeah, and that's why it's so important. Thank you. That's why it's so important to really work with a practitioner when you're at least starting on these medications or throughout your journey. Because, for example, nausea, a lot of people don't understand that sometimes it's either their dose is too high or they just ate something. So GLP-1s, what they do is they help bring down when your sugar spikes up, it helps produce more insulin in your body and it brings down the sugar. And so if you're eating foods that are going to spike your sugar, you're automatically going to feel more nauseous on these medications. So people who go on these medications and have a poor diet, they will be nauseous on it. It just will happen because their body's now producing more insulin to bring down the sugar. And so it's almost as like, I always say it's a messenger, it's a hidden messenger. You're very nauseous on these medications. Yes, sure, you could take Zofran, but also maybe it's time for you to listen to what your body's saying because now you're finally able to listen to it. I always say it allows your gut and your brain to start talking to each other. And, oh, you know what? My body didn't like when I had that Coca-Cola, or my body didn't like me eating that pasta. Or people learn how to eat, meaning that you have to have protein or fiber before you have carbs. And if you change the way you eat, then your sugar doesn't spike up as high. And then eventually that becomes your lifestyle and that becomes your habit. And that's how these drugs are so revolutionary, because they're not just gut drugs, they're brain drugs. They're totally changing the way we eat and how we feel about food. And we're eating slower now because we're savoring the food now. We're enjoying every bite because we know that we're going to feel full faster. We're making better choices. So we know that we only have X amount of space for this food. So we're going to make different decisions. And so I find it so cool that it really helps with it's not just a gut drug. I also call it a brain drug. Hannah, what are your thoughts on the side effects? Did you have any side effects? How did you manage it? Or what was your, what's your take on the side effects of these medications?
So I had a little bit of nausea after my first shot. Super manageable. I mean, and I tell people when I have people ask me about, I'm so nervous about nausea. I'm like, I felt less nausea on this med than I did when I was overeating like crazy at over 200 pounds. So I had a little bit, but I did a lot of research before I went on the medicine too. So I mean, I prepped myself for 5 days before I even took my first shot, making sure I was really hydrated. And I continue to do these things, so like you're saying, smaller frequent meals. I avoid fried foods and greasy foods. If I have side effects now, I'm not surprised. It's because I went out and I had coconut shrimp when I was on a date with my husband. Was it worth it? Like, yeah, probably, but I'm not going to do it again the next day because I don't want to feel bad again. You know what I mean? So at this point, I've really learned like my body and how I respond to things. So like I said, if I have any side effect, I'm not surprised by it because I'm like, oh, I didn't drink my water today or enough this week. And so it never surprises me because like you said, if you're working closely with your provider, you know how to manage the side effects on this medicine. So
yeah.
I always tell patients to really minimize their carb loads. If they're especially they have to retrain how they're eating. Plus, from a side effect perspective, the days of having a big bowl of pasta and a big side of rice, they have to really minimize it. I never tell them to eliminate 100% because that's a big jump for people, the way they've been eating their whole lives. But I usually tell them to try to reduce the quantity of that stuff by about at least 50% for starters. Motivated people can do that. So I always give the big four, I call it. The big four are rice, bread, potato, pasta. Those are the big four that is in tremendous abundance in our food supply and constantly dangled in front of us all the time. So I always tell people to have to really reduce that. So instead of having a side of potatoes, have some sauteed spinach. If you're going to have a hamburger, have it without the bun. If you're going to have sushi, have sashimi instead sometimes. So just, reduce significantly your intake of these things. And that's really what I recommend. And that will also reduce the side effects, and because it will reduce that huge carb spike, which will cause, as you know, a big spike in insulin to be released from the pancreas. And that's one of the ways you can avoid the side effects. Plus, it also starts them on the journey of weight loss, because that's really one of the big culprits, are massive carb loads.
Yeah. It really helps with portion control. This medication, because of the increase in satiety, I mean, the portion control is such a big thing at the end of the day, and there's such a big factor of why people have, you know, double portion control, how American food culture is, and the people you're around, and you know how you're feeling and your emotional relationship with food. But portion control is a major reason for weight gain without us even realizing, and this medication helps. There are
Absolutely. It targets that absolutely directly.
yeah. There are some questions that people are asking, so let's just try to answer a few. Someone asked a question: Can your body need to up the dosage? So they're saying due to tolerance, does that make sense? Do you need to increase the dose? Dr. Deitch, do you have any opinions on that?
Well, I would say that, we always start people on the starting dose of the medication. The effective dose for an individual is individualized. So some people might need a relatively lower dose to have the effect of appetite suppression enough so that they can begin their journey of weight loss. And some people may need a higher dose. Sometimes I've seen people on a certain dose and then they need a little bit more. But for the most part, when someone is on a stable dose, they usually just, maintain it. So I haven't seen too much of that sort of tolerance or what we call tachyphylaxis. I don't see too much of that really. I see people needing to ramp up. It also helps with side effects if you start at the low dose and then gradually build up. But once you sort of achieve the dose where you have a lot of appetite suppression and your weight starts going down, usually they just stay there.
Yeah, no need to go up if it's working.
Right.
Right.
And the philosophy of medicine is always to always use the lowest dose possible that does the job.
Yeah, yeah. I'm a big believer of small doses on this medication. And if you do go up too quickly and like you hit the 15 or the 2.4 really fast, and then eventually that's not going to give you the same appetite suppressant it did from the beginning, like a year or two later. So it's really better to just stay slow and steady. Hannah, I know that you told me that you stayed on a lower dose for a while.
Yeah, I didn't go, and again, because of the research I did before, I knew that I really didn't, because there's the standard dosing schedule where it's every 4 weeks you go up, and then you just go up, and then that's just what you do. And so I really did not want to do that. I made sure I paid very close attention to my body, and I did not go up until I got to the point where I call it getting very squirrely, where the medication would reach its half-life, and then that end of the week I would be very like squirrely, like, okay, I'm wanting to go in the pantry. I'm feeling really hungry, even though I just ate a really solid meal. But like you said, once you find your dose, and we kind of joke in like the online GLP-1 community, like everyone has their dose girlfriend, like their favorite dose, and it's different for everyone. Like people are like, I love 7.5, I hate 10, I love 5. So that then once you find it, then when you're solid, you find yourself not getting squirrely at the end of the week because, oh, this is my dose and I'm good and I'm solid here. So I wasn't quick to jump up at all.
Yeah, that's great. And Ellie, I know your dose because I've been dosing you, but you want to hear I mean, Ellie has been on a low dose and done pretty well. Ellie, you want to share about your doses?
So we started off, I think, with 10 units. I mean, you would know how many milliliters that was, I guess.
That's
And
1.7, guys.
okay,
1.7, very low
and it
dose.
wasn't, I don't know, it was big, so that wasn't really, it didn't, affect me in any way. So we upped it to 20. 20 was just the perfect number. I was able to eat, but I was, had full control of what I'm eating, mindful of what I was eating, and it wasn't like I was fasting. So maybe that's why I had the energy, like I mentioned earlier. But then at the same time, we didn't go up since. So we're doing this, I think it's going to be 8 weeks now, and we didn't up it. I guess we'll have a conversation if we should, but so far it's been working. So I don't see any need to up it. It's consistent. I'm feeling good. If it ain't broke, why fix it? I did something that Bracha wasn't too happy I did it, but I would share it anyways because of the flexibility, like the doctor mentioned earlier. So it was before Purim, and I was dosing on Friday. and I would do every Friday. That was my Friday dose because it takes about, Hannah, I'd love to know how long it takes by you to kick in right away, but I find that it takes a good 24 hours to fully kick in hard. So I found that Shabbos, Saturdays was the main killer. I would be okay all week, and then one weekend, when Shabbos comes, between going to shul and kiddush and alcohol and herring and all the other goodies, and it took the whole week of work and poof, you know. So I would take the shot on Fridays, and that's how weekends were good. And that was like really the clincher here. But Purim was on Friday this year. I was like, not that I'm going to be drinking and pop, but at least I want to enjoy it a little bit. So I actually, on my own, without telling Brooke, I didn't ask her because I knew what the answer would be. So it's little bad boy, and I changed the dose myself. Instead of 20, I did 15 the Friday earlier. So it weared off, kind of sooner. It worked, but my point is that you can customize it as you need it. Like, if you know that you have an event or this or that. But I'm on 20. I'd stay on 20. I would stay, as long as it's working, I would stick to it, and it's been working
I
outstanding.
have a question for you. So on that day, Friday or Saturday, you ate more. How did you feel
No,
after?
the thing is that I didn't eat more, and I didn't eat more not because of the GLP-1, because you know what? I'm not gonna blow it for a couple of hours. So I actually was so proud of myself that even with it being weaker in me, that I still had full control not to. So kudos to Eli, right?
Thank
That's
you.
awesome.
Very good. Good job.
And
So
with
someone
dosing too, sorry, I was just going to jump in and say, just kind of going off side effects is I think that's, in my experience, people I've talked to, if they start feeling side effects, it's generally when they go up in dose and when they go up in dose too quickly and when it's not necessary. That's when they'll start feeling side effects they didn't feel before.
Correct. I was reading a study today that probably close to 10% of patients go off the medication in the beginning because they feel too nauseous on it, which is such a pity because the medication could be used correctly and they wouldn't have, you see people that have cardiovascular risk and they don't go on it because they say, I felt so nauseous, or they're just sick to their stomach and they're like, I can't live this life. But it just doesn't need to be that way. They should have just taken a lower dose and also been advised how to eat. Like maybe some people don't even understand what causes those sugar spikes or what they're eating. So, someone has a question here about what's your response to those who are saying it doesn't cure the binge disorder? So this medication, especially semaglutide, I feel like really helps with binge eating. My quick answer, and curious to know if anyone has any other responses, is really sometimes when patients have ADHD, I see that it doesn't work as well, and we need to do combo therapy. The other thing is that maybe the dose is too high, or they are on the wrong medication. So sometimes semaglutide's a good choice, sometimes tirzepatide's a good choice. And sometimes it's there's an emotional component to it that also needs to be addressed. And people have to realize that this medication isn't going to do everything for you.
Definitely, I agree. And if someone has a binge eating disorder, as opposed to just what we typically see, they should talk to their primary doctor about maybe some medication for ADHD or anxiety that's contributing to it. This medication isn't going to fix every psychological aspect of eating that people have. It's going to fix what things we've talked about, and it's highly effective. But a lot of times you need additional therapy for sure. So anyone who's having difficulty with that type of eating, despite the use of this medication, I would never abandon this medication, because probably whatever they're going through will be worse without it. I would basically seek additional help as an adjunct to this therapy.
Yeah. It's a combination. It's a combination of a few different things.
Absolutely. Multiple
There's so
pieces of
much
the
work we
puzzle.
have to do. Yeah, just a piece of the puzzle. And so it always kind of gives me a little laugh when people say, oh, you're cheating. The only reason you lost weight is because of the GLP-1. And I'm like, no, it's because I totally changed my habits, my movement habits, my eating habits. That's why I was successful, because not everybody is as successful on the medication. And therapy is really important for a lot of us that have gotten up to a certain weight. Well, we got up to that weight for a reason. And so there's a ton of mental work we have to do. And that's the part that is the hard. That's what the hardest part is being really vulnerable and honest with yourself and vulnerable with other people. And, whatever you need to do to work on your mental health too is just so important.
For sure. We all know there's a tremendous psychological component to eating and appetite. And so in some people, it's very extreme, and this medication is not going to fix that in those people necessarily. Although there is certainly a psychological sense of well-being and happiness, and more maybe endorphins. If you start seeing weight loss in yourself and you start feeling well better about yourself, that might also help in that way. But certainly, if someone is really out of control, they should absolutely speak to their primary physician right away
Yeah.
to get any additional help needed.
Yeah. And another thing is that, and some people don't experience food noise. And I know this because I didn't experience it a good part of my life. And so it's very hard for someone who's never experienced food noise to understand another person who has food noise. So yes, maybe the other person has better portion control and has reaches satiety faster, but they don't have the food noise that another person has. So it's like you're comparing apples and oranges and grapes, and it's just not a good comparison. And so I think a lot of people have lived their lives before this medication came out, which is also why it's so revolutionary, that they didn't even realize they were experiencing food noise. Like, food noise is a thing that just became a topic. It was never a topic before. No one ever said, you know what, I'm always thinking about food. It wasn't something that people ever said or thought that it was abnormal or normal, right? No one realized, oh, I have all those thoughts in my brain, and they even processed that they were having it more than another person. And so you weren't able to say like, oh, like 10 years ago, no one was saying, oh, I'm always thinking about food, or, oh, I didn't realize I never think about food. There wasn't a conversation. So this is like a real revolutionary thing that we've learned to, silence.
I think a lot of people that don't experience food noise tell people that do experience food noise that the standard answer is you don't have any willpower. And, we hear that over and over: eat less, move more, just have discipline, just have willpower. But we are living in two different brains, two different realities. You can say, oh, that looks good, but it's not going to make me feel good. It's not in alignment with my goals, and you can move on. Whereas somebody with food noise can look at the plate of donuts, say, don't have that, that's bad, go back to their desk and not stop thinking about it for 2 hours until they walk past them again and they can't do it. I'll just have a little bit and then keep going. It really is two different realities that people are living in. And so I'm glad that these conversations are coming up, though, because I think a lot of people that don't experience it genuinely don't understand. And so these conversations where it's being explained, and I think people are just starting to understand it better. So
Definitely. I mean, that type of food noise disruption of one's life is, it
Mhm.
can be highly distressing. It could be minimal. It could be all they think about. And, these medications certainly can suppress appetite in the brain, and that might be enough to quell these thoughts. And in some people, they're just like a stereo speaker turned on full, and
Yep.
you can't not think about these things. So in those people, again, additional therapy might be needed, along with these medications, but definitely all of this has to be individualized for sure.
Yeah. Ellie, did you want to add something?
Yes, just like you said, it's like when you after a full day of eating and after dinner, and it's like 10 o'clock at night, and it's like you just have that sweet craving, and I'm just gonna do one jelly bean, right? One Mike and I. And it's like, okay, one. And then you just lose control. The next thing you know, you wiped in a full bag and you feel sick and it's regrets. And it's just like, it really, blurs out the noise. It's like, it's noise cancellation. It's unreal how it works, but it's so important. It's like, you don't want to do it. And next thing you know, you're doing it.
Yeah.
It's,
Like
I
I
do
said,
find also, like I mentioned it to you, Bracha, that even with being on the GLP-1, you still have that you have that sweet tooth. I mean, I can't speak on your behalf, but I feel like I need that sugar adrenaline, but I'm able to take one Myconike, I'm able to take one sour stick, one like taffy, or one, sucking candy, and that takes away the craving. And there's nothing wrong with taking that one, it's when
mini one.
you clean the bag, which is like, what the hell did I just do? So it's
Yeah. It gives
I
portion
remember
control.
the first time a bag of chocolate covered almonds lasted me like a month, and I was
exactly.
like, what? How is
Wow.
this still in my pantry? How is this still here? I bought this so long ago.
100%.
It's amazing.
At the same time, it's important, like Brooke always said, it's important that, I have, let's say, my protein lunch, which is a grilled salmon or whatever the case is. Many times, because you don't have the hunger craving, you don't have the call for food, you find yourself at like 5 o'clock and you're almost, ready for dinner. Like, hey, I forgot to eat my lunch. I didn't even think about it. I have to start setting up a reminder that even though I'm not hungry to eat it, it's still important to, you got to set yourself a reminder that, hey, your body needs it. You're hungry. You have to eat it in order to. That was something that I found very, very helpful. I have a 2 o'clock alarm to go eat your lunch, or else it's 7 o'clock and it's still in my fridge.
Yeah, that's good. That's very good. I know that we're coming close to time, so I know there's 2 more questions that I wanted to just quickly answer. Someone had gastric sleeve surgery and they're asking if they can take these medications, which I will say, yes, it's not a contraindication. Such an interesting study that I read about gastric sleeve, that people who have gastric sleeve surgery, a high percentage, I'm not sure the exact percent, but there's a percentage of people who end up having other addictions because they've used comfort as their food, and then they didn't fix the core issue with the gastric sleeve, and they just end up using it toward alcohol addiction. That we see people who have gastric sleeve end up having alcohol addiction, which is a very interesting study. Comes to show that, food is comfort for us, and we have to acknowledge that. And so that has to be something that, whether you're using a GLP-1 or going on gastric sleeve, it's something that you need to identify. It is easier to fix it on a GLP-1 because GLP-1s change your habits, and they give us that real-time feedback. The nausea makes us, okay, I don't want to eat that, and it changes our brain. But either way, it's a really big component of weight loss that we can't, run away from. There's an emotional component to it, and eating slower and being more, paying attention to your food and being more mindful as you eat is something that I think will help a lot of people. I don't know if anyone wants to jump in, and then they want to know your maintenance, Hannah, and if you're going to go on the medication, if you're going to stay on the medication forever. So
I
people
get this
want
question.
to know, you stay on this forever.
I get this question, honestly, probably at least 5 times a day. Like in my DMs and my comments, I get this question all the time because people are so worried about, if I go on, I don't want to have to stay on forever. And this is like so personal to every single person. I mean, I know people who have gone off and lost more weight. I know people who have gone off and maintained their weight. I know people who have gone off and said, nope, not going to stay off, and they've gone back on. For me, when I first went on, I said, there's no way I'm staying on this for life. Are you kidding me? I'm losing my weight. I'm going off, moving on. And then I went through my journey this year and I said, I do not want that food noise to turn back on. I cannot live like that again. I love the decrease in inflammation. I love how I feel. I love the way my blood sugars are regulated now. And so right now, as far as what my maintenance is, like, I'm still trying to figure that out. I'm kind of in the maintenance exploration phase right now, where I don't know what that looks like. I think it'll probably end up changing as time goes on too. I don't know if I'm going to do it every other week or if I'm just going to stay on a really low microdose, or I don't know yet. But if I have to stay on this forever, I will stay on this forever. Like, no shame. I'm good with that. So
Just like wearing glasses, right?
exactly. Yep. Exactly.
Dr. Deitch, did you want to add something to that? I know you had any comments on people going off of it, not at risk to stay on it. I mean,
I don't think we have any long-term data now that there's any long-term risk to staying on. If you've tolerated it, you don't have any strong contraindication to take it in the first place. I don't think we have no long-term data as far as I know that there's any risk to staying on it. Certainly not, especially with low dosing or microdosing or decreased frequency or both. It's not exactly the same thing, but I have patients who take cholesterol medication and then they see, in 6 weeks, their cholesterol is so much better. And then it stays down for several months. And they say to me, oh, well, since my cholesterol is so good now, can I come off the medication? And I explain to them that, you can, but you'll be basically back where you started from within a few weeks, because the metabolism is artificially changed. Your body's metabolism is being changed by these medications to put you in a new healthy place where you would not be without it. So it's, in a way, it's very similar to this. I mean, the reality is that you withdraw this medication from someone's life, their insulin behavior will be different, their pancreas behavior will be different, their brain appetite suppression will be much less, their stomach will empty quicker, and they'll basically find themselves back where they started from. So I think it would be very challenging, not necessarily impossible, but very challenging to stop these medications, arbitrarily, because the risk of basically, going back and undoing all the good that you did over several months or years can definitely just happen again. And so I think right now, I don't see a reason why people should stop. Again, once they achieve their weight goal, you certainly don't have to hit them with the same dose with that in mind, especially, but if it's just a matter of weight management, you can, again, alter dosing and frequency and put them in a new steady state where they'll just have maintenance. So I don't see any urgency to stop the drug right now in people.
Thank you.
Thank
Sure.
goodness.
Thank you. Thank you, everybody. This was so informative. I really appreciate it. Thank you so much for using your voice to help spread education.
Thank you, Bracha.
Thank
Thank you, everybody.
Thank you.
Bye-bye.